Good morning, happy Friday, everybody. I thought I would hop on here and kind of talk about a little bit more of who I am, how I got in this position, and what my last kind of 4 years have looked like after graduating nursing school. So, I'm Eva. I'm originally from Nebraska. I went to the University of Nebraska Medical Center for my BSN, and then I passed boards, so I have my RN, so I am a registered nurse. So when I first graduated college from UNMC, I worked as a neurology nurse, inpatient, and was bedside nursing. This was also like kind of during the height of COVID and was just not a good time. I was making like okay money, I would say. I want to think this is like 3 years ago. I think I was making like around 60,000 when I was a bedside nurse. I will say now bedside nurses are making a lot more than that now. Definitely with like COVID pay and ups and like as they should. So that like kind of, I mean, it was like okay money for like what I was doing at that time in my life. I was just like not having a great time though. It was awful. So then I switched to dermatology, and I actually did take a little bit of a pay cut to go there, but I knew that that was kind of a step in the right direction for where I wanted to get eventually, which is where I am now. So I spent 2 years in dermatology. I learned a lot about skin health, skin conditions, skin cancer, preventing skin cancer, skincare products, and that also led me into my introduction of lasers and microneedling. So I did a few lasers there and a few different microneedling devices while I was there as well. So that kind of opened the door for me and allowed me to kind of transition to where I am today. So where am I today? So I'm in St. Louis now. I moved here because my boyfriend got a job with Boeing. I know Boeing. And so we are here now. We love it. And I got a job with a private practice plastic surgeon. It's a small office, which is really good for me. So I spend 2 days a week, typically 2 days a week with him seeing post-operative patients, and the other 3 days a week I see my own patients. So I do a ton of lasers now. I do a lot of different microneedling devices. I do chemical peels, Botox injections, filler injections, kind of a wide array of different things that I'm doing now, and has allowed me a lot more freedom. My pay structure is also much better now. So I'm about a year and a half into salary plus commission-based pay, and I will say it's very motivating to have some commission-based pay. My base salary is really nice as well. So I'll kind of be a little bit more transparent with that. So my base salary is about 77,000. And then my commission can vary. It just kind of depends on what is on my schedule. But for this year, I should make another 10 to 12,000 on top of my salary. And that's kind of with a schedule that's kind of building, I'll have gaps here and there, things like that. So it's just kind of getting to the point where I'm comfortable financially and everything like that. And it's always so motivating to get to where I want to be. So I'm hoping this year to make close to 90,000. So there's can always go up from there. And that's obviously the goal. So I'm really happy where I am. And I encourage any of you nurses or aspiring nurses, if you have any questions, please ask me kind of what my journey looked like. And if I have any tips for you, I will definitely give them. Everybody have a great weekend.